For most of us, the regularity of our heartbeat never crosses our minds, but every month, about 10,000 Americans with heart failure or an arrhythmia have a device implanted to continuously monitor their heart rhythm and deliver a life-saving shock if needed. These devices are powered by batteries that typically need to be replaced every few years and come at a price that isn't always covered by insurance. Our guest today, Emily Herman, lives with this every day. She joins me now, along with Dr. Ken Stein, Chief Medical Officer of Rhythm Management at Boston Scientific, to talk more about the innovative technology that is helping these patients avoid multiple replacement procedures and save costs. Thank you so much for joining me today.
Thanks for having us.
Now, first, Emily, how were you diagnosed, and what was it like to learn that you would need a heart device for the rest of your life?
So when I was a teenager, I began to experience some dizziness and difficulty breathing when I was exercising. And eventually I went to my doctor, and after they did some tests, they diagnosed me with a heart condition called hypertrophic cardiomyopathy, which in short puts me at high risk for sudden cardiac arrest. So shortly after that diagnosis, I received my first implanted pacemaker and defibrillator at the age of 19.
Oh, wow, that's amazing. Now, how do these ICDSs work, Dr. Stein, and how has the technology evolved to help people like Emily?
Yeah, at Boston Scientific, we actually developed the world's first ever commercially available implantable cardioverter defibrillator, or ICD. That's why we're sponsoring this interview today. And what the ICD is, it's an electronic device that gets surgically implanted under the skin, and then typically there's a wire or a lead that goes through a blood vessel into the heart itself, and the device then monitors every single heartbeat for a patient like Emily. And if the patient has a cardiac arrest and is in danger of passing away, it can deliver a shock to the heart and restore the rhythm to normal. I mean, just like on the TV medical dramas, you see them come running with the paddles and shock a patient back to life.
That's interesting. Now, when you talk about these devices, why is battery longevity so important for doctors and for healthcare systems?
Battery longevity is important for docs, for the healthcare system, and I think most importantly for patients like Emily. What a lot of people don't realize, until they actually get to the point where they need one of these, they're not like typical consumer electronic products, where if your TV remote battery goes on you, you just flip open a panel and put in a new battery. These devices are hermetically sealed. And so when the battery runs down, you need to have a surgery procedure. You need to take out the whole old unit and put a whole nother new unit in. And every time a patient has to have surgery, there are risks involved in the surgery, there's discomfort involved in the surgery, and then of course there's the cost of the procedure, both for individual patients and for the system as a whole. It's why we went ahead and developed this proprietary battery technology. It's called EnduraLife. We've now got 9 independent research studies that confirm the superior battery performance of these devices. In fact, they last up to 2 times as long as older generation devices or some of the devices that our competitors are still marketing today. And that can have a huge impact. In England, where there's national health care, they've got an organization called NICE. It's the National Institute for Health and Care Effectiveness. It's probably the world's preeminent health economics organization. And NICE just recently issued a recommendation that docs in England should preferentially use devices with our EnduraLife battery technology. And they estimated that if they did that, they would save the system in England alone £6 million over 5 years.
Oh, wow, that's amazing. Now, we talked about replacements and how the EnduraLife can decrease those replacements. Emily, tell us, how many device replacements have you had, and how has your condition impacted you and your family?
So over the past 14 years, I've had 3 devices. The first 2 each lasted between 2 and 5 years, which was really concerning to me when I thought about the length of life and the number of surgical procedures that could mean for me. But not only from that standpoint, also the financial piece. I have a high deductible health plan. So for me, that means that when we're having to undergo another device replacement, I'm having to prepare financially for that. It isn't just a savings account that I'm planning for my children's future college funds or family vacations or unexpected home repairs. I'm also having to account for the inevitable device replacement. So my most recent device, my third one, I've had now for the past 7 years, and I'm thrilled to say that the battery life on it still is expected to have another 5 left.
That's wonderful. And Dr. Stein and Emily, what advice would you have for someone who has this device, and also their loved ones who may also be concerned about the multiple procedures, and how should they go about addressing it with their, or recommending or suggesting it to their healthcare provider to look into EnduraLife?
I think what's most important, and it's not just true about this condition, but in general, right? I think patients are their own best advocates, and I just encourage everyone to go out, do your homework, do your research, and then ask your doc the questions that are important to you. Because the only way docs know, what are your priorities and what are your concerns are if you're open and you ask us about them. For folks who want to learn more specifically about battery longevity and these devices, there is a website, devicelongevity.com. And again, I'd encourage folks to go in and do their homework and to look at it.
Awesome. Thank you so much for that. And again, for more information on EnduraLife as well as other information about everything we discussed today, visit www.devicelongevity.com. Thank you so much again, and best of luck to you, Emily.
Thank you so much. Thanks for having us.
Yeah, thank you for having us and giving us the time.
Have a wonderful day.
You too.